And I think that as a doctor, I will tell you that doing both home care and home health has been probably the most humbling experience. And the reason for that is that when we see patients in a clinic setting, it's very sterile, right? We see you for 10 minutes, 15 minutes, we tell you a bunch of stuff. Even if you're able to tell us back what you heard us say, you may or may not actually comprehend that. You may not
Mhm.
remember it by the time you get home. And so then sometime later, you come back either to see us in the office or you end up in the hospital, whatever it is. And I'm sure your listeners will acknowledge that they've heard physicians or healthcare providers say, oh, that patient is non-compliant. And it's not until you do home care and home health that you realize that most people actually really want to do the right thing and they really do want to be taken care of and have the best care possible, but they don't have the resources. They don't have the social support. And so once you get out into the world, right, it's a very different environment than when you're sitting in a clinic. And the other thing is that
Mm.
patients do themselves a disservice because they frequently want to put their best face forward and they tell us they're doing stuff or they understand stuff when they don't. All you have to do is think about, maybe your mom who or a friend of yours who gets dressed to the nines, puts on their makeup, and going to the doctor looks totally put together, and yet you see them on another day and they haven't gotten out of their pajamas, but they don't
Oh,
want the doctor
yeah.
that.
That is an interesting thing, I imagine, as a because it's a completely different setting.